anatomy and physiology. I'm going to do a review for you, hopefully practice for this first practical exam that you've had. During the course of this exam, you're going to come in with your partner and you're going to draw a card. The card will say the ranges of motion that you're going to express to me. The first range of motion, if you draw cervicals, there's 9 ranges of motion that I want you to show me. The first range of motion is flexion, extension, hyperextension. Okay, so that's flexion, extension, hyperextension. Then you have right lateral flexion, left lateral flexion, right rotation, left rotation, protraction, retraction. Okay, so protraction, retraction. And that's all of your cervicals. That should be 9. I placed hip and shoulder together on your study guide because of the same ranges of motion. I thought it would be easier to study. So if you draw the card that says shoulder, you're going to have 7 ranges of motion. The ranges of motion for the shoulder are flexion, extension, abduction away from the midline, adduction towards the midline. Okay, so that's abduction, adduction. I have internal rotation, external rotation, and then circumduction. And circumduction is a coupling of motions. For the hip, I have the same exact ranges of motion. So for the hip, I have 7. I have flexion and extension. I have abduction, adduction. I have external rotation and internal rotation. Now one thing I want to show you on that is, watch my hip. When my foot comes in, my hip externally rotates. When my foot goes out, my hip internally rotates. And that has to do with my knee being bent backwards. That's why it's the opposite of my shoulder. And the last range of motion for the hip is circumduction. Now, next range of motion will be the elbow and the wrist. They'll have 7 ranges of motion. The elbow has 2, flexion, extension, unless you're Mr. Newberry and you get hyperextension. For wrist, you have flexion, extension, hyperextension. Okay, so that's flexion, extension, hyperextension, and then you have supination, pronation. I need some soup. Pour it out. All right, supination, pronation. Your last range of motion is going to be the card that would say knee and ankle. For knee and ankle, the knee, you're simply going to go flexion, extension, and for ankle, I'm going to try to show this pretty good so you can see it. For ankle, if I push my foot down, okay, that's the plantar surface of my foot on the bottom. So when I push my foot down, that is plantar flexion. Let me show it from the side. Plantar flexion. When I bring my toes up, that's dorsiflexion. And then I have inversion by simply tipping my foot in, and I have eversion by tipping my foot out. Most ankle sprains are inversion, when you roll over your ankle. So inversion, you bring it in, eversion, you bring it out. And that is all of the range of motion portion of your exam. Now, when you come in, you and your partner, you'll draw 2 more cards. One person is going to be the first person or the talker. The other person is going to be the second person and the doer. Okay, the first person, the talker, is going to do a couple things. They're going to tell me where the 5 major structures of the knee that we've talked about are and their function. Now you can explain them to me verbally. It's probably easier to show me on yourself. Any way you express it, I'm fine with that. Okay, so what you're going to do is you're going to say the lateral collateral ligament is on the lateral portion of my knee, or the outside of my knee. The medial collateral ligament is on the medial portion of my knee, or the inside of my knee. The ACL, the anterior cruciate ligament, is in the middle of my knee. The ACL and PCL, they're called the cruciate ligament because they look like a cross. They're in the middle of my knee, but the ACL runs forward. Okay, as I look down, the ACL runs forward and hooks into the tibia, and the PCL runs posterior and hooks into the tibia. And then the meniscus is distributed pretty evenly between the femur and the tibia. The second part that the talker is going to have to do is explain to me what each structure does. So the lateral collateral keeps the knee from bowing laterally or out. The medial collateral keeps the knee from bowing medially or in. The ACL keeps the knee from moving anteriorly. It's the anterior cruciate. It keeps the tibia from moving anteriorly. And the PCL, posterior cruciate ligament, keeps the tibia from moving posteriorly. The meniscus, like I said, is distributed all around inside the knee between the femur and the tibia, and its job is just to cushion the joint. First person's done. That's 10 points. Okay, you described all 5 structures, where they were at, and you told me what each of the 5 did. Now the second person is going to be the doer. Okay, they actually get to show me a little bit of an exam. Not expecting to be perfect. I just want you to get used to it and be able to show me what the structures would resist. So Dana, if I can have your help. Go ahead and have a seat up here. So the second person is going to come in, and the first thing I'm going to do is I'm going to say, okay, during the course of this exam, where are you looking? And hopefully you tell me, I'm looking at their face. I'm going to ask you why you would look at their face, and you're going to tell me so that I can see if they're in pain. I can see their expressions change. Okay, a lot of people won't verbalize when something hurts, so you always need to look at their face so you can see that change in facial expressions. Then what you're going to do is test the 5 ligaments for me, or excuse me, the 4 ligaments and the meniscus for me. Okay, so to do that, I'm going to bring their leg up. Now, on this first part, I don't have their knee bent all the way up. It's almost extended, just a little bit of bend in it. And to test the lateral collateral, I push laterally. I push from the medial side to the lateral side. So I push laterally. To test the medial collateral, I switch hands and I push the knee medially towards the midline. So I push the knee medially. To check the ACL, I put their foot down on the bench or the table or whatever we have there, and I'm going to stabilize that foot. I can do it with the hand. I can do it with the knee. I've always done it with the knee. So I'm going to stabilize the foot, and I'm going to try to pull the tibia anteriorly. It's the ACL, so I'm pulling anteriorly. The posterior cruciate ligament, I push the tibia posteriorly. And then to check the meniscus, go ahead and roll face down for me. I'm going to roll them face down. I'm going to bend their leg up, and I'm going to push into their foot with this hand and twist. And all I'm doing is driving that tibia into the femur, so I'm compressing that joint and I'm twisting it. Just like that. Go ahead and sit up for me. For the second portion of what you're doing, you're going to explain to me what you would feel. I'm going to ask you what you would feel if a ligament was damaged. And you're just going to say, I would feel gapping. Okay? I wouldn't feel that in play on the joint. My hand would go all the way through. And once you do a few of them, you'll notice a drastic difference when there's damage to it. I'm going to ask you what you would feel if there was meniscal damage, when you have their knee bent up and you're pushing down into it. And you're going to tell me that you would feel popping, cracking, and that the patient would also express some discomfort or pain. And that is your entire practical exam. So I'm looking forward to seeing how you guys do. Study, review this tape. Hopefully it helps. I'll see you in class.